Hi Shay, thank you for offering to give up your time today to talk to us about the mpro haemophilia application. It's really appreciated and always very useful for us to get some feedback from patients. How long have you been using our mpro haemophilia application?
I've been using it now for about 6 months, since last September.
So what do you think are the advantages of the system?
For me there are two advantages. Firstly, it's to do with the service, and the secondly is to do with the safety. If we talk about the service first of all, what we used to do was fill in these pink sheets, little forms that we used to send off to the hospital, recording what treatment that we had taken. Now, naturally this meant everything was actually done over a longer period of time. It might be 3-4 months afterwards that I would actually send the forms into the hospital so that they would actually get a chance to look at them. But with this new system it means that they're actually recorded in real time using the device. And the advantage of that is that the hospital knows nearly instantaneously what treatment that you've taken. And within a day or two they could be notified if you were taking, say, a shot for a very serious bleed that they thought that you might need to come in for consultation. Something like a head injury or an internal bleeding or something like that. So therefore they would contact you nearly immediately to sort of say, ask you are you okay, and to see whether you need any further consultation. It also meant that the clinical review was much better. What I mean by that is that they would be able to follow up the type of treatment that you're taking. They might notice, hang on a second, you've taken an awful lot of treatment for that one bleed. Have you got a problem with that particular joint? Or are you taking enough treatment? Do we need to recalibrate your treatment to make sure that you're taking enough? As well as that, then it also means that when you go in for a consultation with the doctor or the consultant, they actually have an up-to-date reading of all the treatment that you've taken, right up to date. And it also means that they can start addressing maybe problem joints or problem bleeds that you might be having. And also, because we've been given a web viewer as well, you can actually do that for yourself. You can actually have a look at what treatment you've been taking over the last number of months, and you can actually then go in prepared for your consultation with your doctor. And I think all of this is much more reassuring to know that the hospital is looking after you, as it were, remotely, and that not everything is happening sort of 3 or 4 months in retrospect like it used to happen in the past.
To recap on what Shay has been saying, this is the mpro haemophilia smartphone application as used by patients. Each patient is given a username and password which they use to log into the application. Patients can then review their contact details and medications to check that these are all correct before they proceed. Once checked, the application will instruct the patient to scan the barcode on their medication vial to check that it matches their prescription and that it is in date. If all okay, the patient will be displayed with a message like this one. If not, the patient will be advised not to proceed. Next, the application asks the patient for the reason for the infusion, the area of the body they performed the infusion, and details of how severe the bleed was. All of this information securely synchronises with the NCHCD server and keeps relevant healthcare professionals up to date, just as Shay had been describing before. So, going back to Shay, what are the other positives of the mpro system for you?
The second advantage I see is the safety aspect of it. I'm old enough to remember the blood contamination issues that happened in the 1980s, and that was an awful tragedy. But safety has improved substantially since then. We've had new products, safer products, better tendering for products so that we actually get the best products that are available. And this app is sort of another brick in the wall of that safety, because when you actually go to take your treatment and you scan the actual bottle to make sure that there's an actual check done straight away to make sure that that product hasn't been recalled for any safety reasons. So again, that's very reassuring from a patient point of view to know that the product that you're taking is the most current and most effective product. So for me, those two aspects are the main advantages. One, from a service point of view, because I think the service that we're getting from our treatment providers is much improved, and secondly, from a safety point of view.
It must also be a weight off your mind knowing that the system checks that the medication is the one prescribed for you and that it hasn't passed its expiry date.
Yes, I should have mentioned that really as part of the safety, that it does check that the product is the right product, it's the one that's prescribed for you, and it also is still in date.
Do you find the application on the smartphone easy to use?
In fact, it's actually very simple to use. The only thing you have to make sure is that you've got enough light so that it can actually read the barcodes. But apart from that, it's extremely simple to use.
What do you like most about the application?
The fact that it is actually so simple to use. I mean, it is great that it doesn't take forever to fill it in. The forms were fine when you were handwriting them in. They didn't take an awful lot long to do. But what I do like is that this is doesn't take you any longer to do than it used to. Plus, also, I like the comfort of knowing that it's being monitored in the background.
What do you find most useful about it?
I find that, for instance, if I'm away from home or travelling or something like that, you actually have it on your phone. It's with you. It's all there all the time. And if I'm travelling, I would have to take treatment with me, and I don't have to remember bring pink slips or anything like that. You always have your phone with you, and therefore it's a great advantage of actually having it on your phone.
Do you feel that there is great potential for this system to be used by other chronic disease groups who require to medicate regularly in their own homes?
Oh, I suspect that definitely there would be, particularly if there was the same sort of medical care backup, so that people can be monitoring how you're doing. I expect that there would be great uses for it.
Well, thank you, Shay, for giving up your time today. That certainly was very insightful, and we wish you all the best for the future. Thank you.
Thank you very much.